Yeah, one more regular question like Android and iOS. Some people like Android, some people like iOS. They fight, right? In the same way, some people are more favored towards root canal. Some people are more towards fillings. Okay, so what is the difference? Which is better if the choice is given?
This is a question which is very problematic nowadays, because it's not the patient who decides to go for a root canal treatment or filling, or nor it's the doctor who decides to do filling or a root canal treatment. It depends upon the tooth condition and whether to go for a tooth restoration or go for a root canal treatment. As I mentioned to you prior, again,
Can you,
there are,
in simple words, can you
yeah.
explain what is root canal treatment and what is
So again, there
filling?
are three different layers in tooth, which is enamel, dentine, and pulp. So normally filling is required for two conditions. One is wear and tear, which is called as attrition abrasion, that is aggressive brushing of the tooth or aggressive wear of the tooth when you bite. So these require filling. Other than that, very important aspect is tooth decay, which requires filling. So if the tooth decay extends into the first or second layer, that is enamel or dentine, which can be repairable, that is removing the decayed portion of the teeth and filling it with a specific material. There are different materials in filling materials because of the advances which has come out. There
Yeah,
are,
which is famously called as cement, white cement.
yeah, so famously called a white cement. Nowadays, composite is something which is going on in the scenario. So there are different sorts of materials. Let it be amalgam, let it be glass ionomer, let it be composite, let it be any other upgraded materials like infused materials and composites. So these are definitely the materials which are there for filling. So again, depending upon the patient's convenience, depending upon the tooth specific requirement, and also economics. There is, see, dentistry has become so dynamic. It's always put forward to the patient, select which one do you want, because patient always
Wants choice.
wants choice. And also there are different sorts of patients, means again, not to point out, some people tell here it's done in a very cheaper price, there is done in a very expensive price. Yes, definitely there is lots of difference in the price in the market, because dentistry is always dynamic. It depends upon the person who is preparing your tooth or who is working onto your tooth. For example, if a general dentist or a regular general dentist with a minimal setup is working with the patient, definitely his charge would be a bit more less compared to a specialist who is much more experienced, expertised in the subject, as his material aspect also changes. So when there is too much amount of difference in the material, the patient doesn't know which material to select and he should rely on to the doctor's choice. So going to a proper expert or a specialist, as you told, fillings or root canal treatment, the specialist is called as an endodontist or a conservative dentist. So expertise like these people will know how and when and which material to use so that the filling will last longer. I've seen many patients come to me, sir, we have just got the filling 2 or 3 months back, and within that time, the filling has come out. I've seen few cases where, sir, last week we have got the filling performed, today it's there in my hand. What to do? So that's because of improper knowledge of which material to use and how to use in that specific tooth condition scenario. That's what I'm trying to tell. When you asked me root canal treatment and filling, it's not patient's choice or it's not the doctor's choice. The doctor should analyze what's the tooth condition, whether it will take up the filling or not, or when the filling is performed, whether it will stand longer or not, supporting the function, aesthetics, and the convenience of the patient, providing the natural sort of feel as before to be restored.
Okay.
That is very important when we are doing a filling. If a patient comes to me with a broken tooth, and if I just put a patch of some material which is not matching his tooth shape, size, color, it is completely awkward. So in the same way, we should plan in such a way that it solves the aesthetics, it solves the function, it solves the comfort of the patient. So these three are very important when we are doing a filling part. Now moving on to the root canal treatment. When the decay of the tooth extends into the pulp, again pulp is nothing but the tooth structure which contains blood vessels, connective tissues and the nerve tissue into the pulp or the tooth chamber, where there is continuous supply of blood onto the tooth. When that is hampered by the bacteria which enters into the tooth, there is damage of the nerve tissue, blood vessels and the connective tissue, which needs to be removed and should be restored to proper function and aesthetics for the patient. So in such conditions, we do a root canal treatment. Simple is when the patient comes to you with severe pain. There are different sorts of conditions in it. After the caries, that is called as pulpitis, that is infection to the pulp, or periodontitis. If the infection goes beyond the tooth into the bone because of the negligence of the patient, there is severe amount of pain on biting also. That is called as periodontitis. And other condition, still the patient is not considering his condition, goes to a pharmacist,
Yeah.
or just take the painkillers and calms down the pain. It might lead to a severe infection called as abscess. So whenever there is small issue with your tooth, if there is mild sensitivity also, directly visit the dentist or the expertise, whoever is there, so that you get it resolved before in hand instead of going for an aggressive treatment. So that is how root canal treatment is performed, removing the pulp tissue, putting a medicament in it and then filling it up once the condition has been subsided, that is the pain condition has been subsided. And after completing the root canal treatment, the tooth becomes very brittle because there is no blood and nerve supply. So onto the tooth structure, you should give a cap or a protective material which takes up the load, because whenever we bite, there is too much amount of load which falls onto the tooth. So a protection is very important onto the tooth structure, which might be a direct restoration or an indirect restoration, which might be a cap or another sort of fillings called as inlays or onlays, which will help in protecting your tooth without getting fractured after your root canal treatment procedure.
Yeah. Finally, whether to go with root canal treatment or fillings is not the choice of the patient or the doctor. It depends on the condition of the tooth, right?